So now you've saved their life, right? You've made sure that this patient is not going to die on you in the next 5 to 10 minutes. So let's see what we have to do next. This step in patient assessment is where you really get down to what's going on with your patient. This is how you find out not only what's wrong with them, but what the appropriate treatment is going to be. Doing a good secondary assessment is the difference between your trip being a success, your trip continuing, you getting your patient out, or having a really bad outcome. We need to make sure that we find everything that's wrong with our patient in a secondary assessment. In a front country setting, we have the ability to get a patient to a hospital relatively quickly. If something gets missed, well, we don't like it, they're at a hospital. The hospital can then do further evaluation. In the backcountry, all you have is you. You have your senses, your eyes, your ears, your ability to interpret signs and symptoms that you see. You need to be thorough. You've got to make sure that you do very good secondary assessments. I'm going to put up here on the board the components of a secondary assessment. And then in a few moments, we're going to go through each of those components and talk about what they mean and how you use them. So let's start out. The first thing you have to do when you get to a secondary assessment is decide what type of patient do you have. Do you have a trauma patient or a medical patient? Now, it might seem weird to break people up into that category to say, oh, isn't everybody a medical patient? That's what medicine is. In the world of medicine, we break patients into two categories: trauma patients, medical patients. A trauma patient is someone that suffers an injury, meaning something has happened to them. They have had something occur to them from the outside that has caused a traumatic injury to them. A medical patient is someone who's suffering an illness, something that has occurred to them internally, basically. So when I think trauma patient, I think broken bones. You think bruises, you think cuts and scrapes, bleeding, those types of wounds. If I'm thinking medical patient, think heart attack, anaphylaxis, seizures, asthma, strokes. Those are medical patients. We have to put our patients into one of those two categories. The reason is the assessments for both of them are relatively the same, but we go about them in different ways. We approach them in a different manner. If you were to walk into an emergency room, you would see the general emergency room beds, and then you would see a couple of specialized rooms. One is called a trauma bay, one's called a medical bay. They're there because when patients come in who are having life-threatening emergencies, they need to be decided, are they a trauma patient or a medical patient? And they need to go to the appropriate bay. A trauma bay is set up very differently than a medical bay because the assessments we give are very different. This is what we need to do. Do we have a trauma patient, an injury? Do we have a medical patient, an illness? Now the question always arises, can I have both? Can I have a trauma patient that's suffering a medical complication? Can I have a medical patient that has a traumatic injury? Absolutely, that can happen. So what do you think you have to do? We need to triage. We need to say which one of their problems is the most important problem. If a patient has a broken leg and is also complaining of an upset stomach, well, that patient's going to be a trauma patient. And if a patient is having a seizure but also has a sprained ankle, that patient's going to be a medical patient. So we always choose the category that is the highest priority for your patient, trauma or medical. Trauma patient, medical patient. So how do we go about assessing these patients? Like I said, the assessments are relatively the same. We just do them in different orders. Let's start with a trauma patient. When it comes to a trauma patient, the best way to get information about their problem is with a physical exam. Remember, trauma is an injury. Something has happened to this patient. What I need to do is find that. In a hospital setting, we would use x-rays or CAT scans or MRIs. I don't have those in the backcountry setting. I've got my hands and I've got my eyes. I need to put hands on this patient and do a physical exam. Now, there are two types of physical exams that you can do. One is called a full body exam. The other one's called a detailed exam. A full body exam is exactly what it sounds like. It's a full body exam. You go head to toe, inspecting every inch of that patient's body for injuries. A detailed physical exam is when you only look at an area where the injury might be. Why might I choose one over the other? A full body exam might be employed when the patient can't give me enough information about the incident, when they're foggy, when their symptoms are vague, when the patient's unresponsive, when I just don't know what's going on. I might choose a full body exam. The patient has experienced a traumatic event, and I just don't have enough information to make a decision yet. I'm going to do a full body exam, head to toe. When I have a patient that's reliable, that's able to give me information, that can tell me it hurts here, then I can just focus on that part of the body, and I can put my hands on that and do an assessment. So step one for trauma, exam. Full body or detailed. You pick. Step two for a trauma patient. Well, now I've done my exam. You should have a good understanding of at least what you have found, what's going on with that patient. So now what I want to know is there any other information about this patient that I should be aware of? What we're going to do is what's called a sample history. A sample history is designed simply to get more information about the patient themselves. The way I want you to think about this is when you walk into your doctor's office for an annual physical. You go up to the reception desk and they hand you a clipboard. And it's got 3 or 4 different papers on it, and it asks you 100 different questions about all sorts of things about your medical history, none of which necessarily have anything to do with what you're there for today. What are they trying to get? They're trying to get a general picture of you, of your health, of any complications that may interfere with what I found in the trauma assessment. That's what a sample history is. Now, sample, you might be saying, what does that mean? Well, each of those letters stands for an assessment that we're going to do. And we're going to explain those to you in a little bit. But right now, just understand that a sample history is a general picture of you as a person, medically speaking. Then we have a third step. The third step is the vital signs. Now, most of you have probably heard about vital signs, and probably all of you could give me at least one vital sign that you know of. That's because vital signs are sort of a ubiquitous piece of knowledge that everyone has about medical problems or traumatic problems. We're going to talk about vital signs very specifically a little later in this class. I want you to understand right now, though, that vital signs don't mean what you think they mean, and they're not used for what you think they're used for. We're going to get them, though. We need to get vital signs because they do have a use. We'll talk about what that use is a little bit. That's your trauma assessment. You come in, you have a story that tells you they had an incident. Something impacted them from the outside. They had a traumatic event. I choose trauma. I'm going to do an exam, either a head to toe or a detailed. I'm then going to get a good history on my patient, and I'm then going to get some vital signs. Let's move over to the medical assessment. On the medical side of things, I have to approach it a little differently. A medical problem, remember, is an illness. A patient who says, I don't feel good. My stomach hurts. I feel weak. I feel dizzy. I feel nauseous. All of those things indicate a medical condition. Well, how do I get more information about those conditions? Touching and feeling them, doing an exam, is not necessarily the best way to go about that. Someone who says, I have a headache, squeezing their head is not really going to reveal anything to me. What I need to do is ask a lot of questions. Medicine can be very difficult. Medical patients are a detective story. It all comes down to asking questions and listening to the answers. So to start out a medical assessment, we're going to start with a series of questions. I'm going to put another jumble of letters up here on the board in a second, but I'll explain what they mean as we get further on. The questions that we can ask can be directed by these letters. O, P, Q, R, S, T. Each one of those letters stands for a question that we can ask. These are not all the questions you can ask, and we don't always have to ask all of them. But it's a way to get you started. It's a way to get you engaged with your patient and try to begin to understand what their medical condition is. Now, I just told you a moment ago that vital signs don't mean what you think they mean, and they're not as important as we think they are. But here's the thing. I'm going to put them up here under OPQRST as your first step for a medical patient. But you'll see how it makes sense in a moment. Step 2. Step 2 is the exact same as the trauma assessment. I'm going to do a sample history. After questioning my patient about their medical condition, I should have a good idea about what's going on, or about at least what they're complaining of. Now I want to get an idea of who they are as a medical person. So I do the same sample history. Step 3. Now, step 3 may seem a little weird when I tell you what it is, but it's something that you're going to do no matter what you're dealing with. Step 3 on a medical patient, we're going to do an exam. I told you at the beginning of the medical assessment, squeezing somebody with a medical problem may or may not give you any information. So why am I telling you to do it now? Well, I'm going to tell you to do it, but I'm going to put a question mark after it. The question mark means you need to make a decision as to whether or not doing an exam is going to help you out. It's up here because sometimes a patient suffering a medical condition can have a traumatic injury that's being masked by that medical condition, or could have had a traumatic event that precipitated a medical condition that's now being masked by that medical condition. So if you're not sure, the symptoms they're giving you are vague, the signs aren't pointing anywhere, go ahead, do an exam. You never know. It's always better to do more assessment than less. When it comes to doing assessment, be thorough. Don't make assumptions at the start. Don't come into your patient saying, I know what it is, then try to prove it with your assessment. Come into your patient saying, hey, my patient doesn't feel well. My patient's injured. I'm going to investigate to try to figure out what's going on. Once you make it through your secondary assessment, you should have a good idea of at least what's going on with your patient. You may not have a diagnosis, and that's okay. There are thousands of medical conditions. There are thousands of traumatic problems that can occur. You're not going to be able to learn all of them in a wilderness first aid class. You will learn the most common ones. But more importantly, you will get, by understanding how to do patient assessment, you will get an idea of what is going on with your patient, what systems are involved, and what steps you need to take. So by the time you finish assessment, by the time you've made it from here to step 3, from here to step 3, you should be able to put together a list of problems that you found. That list may just say, patient complains of stomach pain. You might not be able to get any further than that. Or you might be able to say, patient has bone protruding from left forearm. Fantastic. Patient has pain over left inside of the knee. Or the patient has deformity of the right ankle. All of those things are going to be your problem list. You got to remember to list every problem you find. This is why you need to be thorough. Once you have a problem list, we're going to be able to put together a treatment plan. Treatment comes much later. You're going to learn how to treat all these things in this class, but it comes later. If we go back to that example of the broken arm in the emergency room, you were sitting there for 2, 3, 4, 5 hours waiting. It's okay. You aren't going to die. When did they treat you? Much later. After their assessment said you only have a broken arm. We need to do the same thing. You as a provider need to take a big, deep breath, do really good assessments, come up with a problem list, come up with a treatment plan for each of those problems, and then we're going to treat. That's how we get through assessment.